Now let's switch gears to eye diseases. They're common and can go unnoticed for a long time because some have no symptoms at first. So an eye exam is imperative for diagnosis. Is that correct? We don't see some of these symptoms.
That is correct. The classic disorder that we'd see with that would be glaucoma. Glaucoma meaning high pressure in the eye. Even the most astute, savvy, and intellectual person would not know about glaucoma. There are other things, of course, and let's talk about some of those.
Yes.
Common things are common. For openers, cataract. Well, cataract is going to happen to everybody. You will never escape that. If you're over 59, you're going to have some degree of cataract.
Okay.
It means that the lens is getting darker. Yes, I suppose it is a disease process, but we're all going there. Diabetic eye disease, that is a big problem.
That's tied to weight, though, correct?
Yep. That's only, of course, going to be in diabetics. Type 2 diabetes tied to weight. If you are diabetic, you must get into your doctor. Your ophthalmologist needs to see you at least once a year. That is a classic case of a stitch in time saves 9. If we get in early, we can prevent a lot of things. When it's late, there's trouble.
There's trouble.
We talked about glaucoma. Glaucoma means high pressure in the eye. That is never normal. You're not going to know it. The doctor's going to surprise you, and you're going to say, what? That has to be taken care of. It's progressive, and it doesn't produce symptoms until very late.
Can that cause blindness?
It will lead to blindness eventually if unattended to, and unfortunately, a lot of our patients come in late in the game and they're already partway down the drain to start.
So how often then do you recommend these eye exams so the patients don't miss something like this on their exam?
If you have a family history, my aunt, my brother-in-law, my brother, both parents had glaucoma, you ought to be thinking about that at around age 40, and you ought to be coming in yearly. Again, for normal people, a normal 16-year-old, what's the chance of that 16-year-old having a cataract or glaucoma? Really low. Okay. What's the chance of a 58-year-old having something? Very high. And so like older cars with 60,000 miles, cars with 80,000 miles, they will have things that happen, and so you need to have some maintenance, at least have it looked at on a regular basis. My golden rule I use, at age 60, you need to be coming once a year no matter what you have. If you have other factors, family history, if you're diabetic, you need to be coming every year. Even an 8-year-old diabetic needs to come yearly.